and then we're gonna
Okay, do this. Okay.
having
Okay, now I feel better.
fun. Happy Friday. I'm Blake Hotchkiss, Clinical Education Specialist with the Association for Vascular Access, and join with me today, Judy Thompson, howdy, hey, and
Howdy,
Dr. Andy
hey.
Baxter, hey.
Hello.
Hello.
You win the Letters After Your Name award, Blake. You win.
I thank you. I would brag that they used to be longer, but I've trimmed them down over the years. So thank you.
You don't want to go with too many because then we'll make fun of you too.
No, it would, you got to keep it concise so that you can actually fit it onto a description.
Like that guy with all of the different banners under his badge, right? At some point, you're like, "What are you proving here?"
Yeah.
I know, and doesn't he pee on it when he goes to the? No, I'm kidding. Let's go down a different pathway now. But
Well, howdy, hey guys. So we're here to talk about a couple different things. Judy, let's talk about health equity first, and then we will get to the meat of the matter of today's discussion right after that. So I'll let you kick things off.
Guys, we've been talking about our health equity project now for a few weeks, and we launched a while back the patient survey on health equity, where we asked you guys to fill it out, even though many of you are clinicians, but you're also patients. And now we just launched the clinician survey. So it is a paired group within the study. So we are asking you, imploring you, please take that survey and share it. Share it with your colleagues, share it at your hospital. Anybody that's ever put a PIV in California, not California, just California, only California. No, I'm kidding. In the United States and or Canada, if you put an IV in, please take the survey and please share it with that same group. Yes. We are very hopeful to make correlations between what the patients say and the clinicians say, either correlations or find the gaps in practice. So it's exciting. It's not been done. And I think this area is so needed. So very needed. So very much so. I think Blake has put the links down below for us on that. Yes.
So if you're a patient, there's I should say, looking at the patient perspective, if you are a person who has ever had an IV placed in their life and live in the US and Canada, option number one. If you are a clinician who places IVs and have ever placed one in your career, option number two. And then
we're going to you can do both.
And you can do both. It's not restrictive to one or the other. Please do both if you have had those unique experiences. And with that, let's talk about pain relief in dialysis access.
So, Dr. Baxter, thanks so much for coming back and hanging out with us. Always fun.
Well, I am so glad to be here, and I'm very excited to see both you and Blake are dabbers. So that's, even more fun and things you don't find out unless you're doing a Facebook Live.
Cool. Dabber dabbers.
I know. You tossed down the challenge. We got to go with that. So a couple things. One, I do want to say, off topic entirely, your son Max did something pretty cool recently, right? Didn't he win? Oh gosh, it was an athletic contest.
Parkour.
Thank you.
Yeah, exactly. Yes. He's number 3 in the nation for skill, and the young man goes on to the World's competition in Vancouver next week. So,
wow. Well, you'll have to update us on that.
I will. Thanks for following my feed.
Oh, always. I'm a fan. So let's talk about dialysis and, gosh, the plight they go through, but specifically access pain and what we're talking about today. I'm going to give you the floor a little bit and kind of give us the lay of the land.
Sure. So there's some differences in people that have procedures every day or once a week, or in the case of dialysis, between 2 and 4 times a week, that are a little different than your normal access pain. So I have been learning about this because we have a new Buzzy unit that our Netherlands partners, DaVita, has. Buzzy is used in the Netherlands for dialysis. And they're like, it's nice, but could you change it around a little bit? So in doing that, we're trying to get Medicaid to pay for it. And so writing reasons why it's particularly useful, I've really been learning so much more about cannulation. So the very first awareness I had as a pediatric emergency doctor was when a woman showed up at our door with a basket of treats because her father was going to quit dialysis because of the needle fear, and used Buzzy and didn't, and lived another 3 years.
Oh,
So
wow.
what I know now is that 47% of people on dialysis will admit to needle fear. What they say from the Netherlands is that having an immediate option has allowed people to talk more about needle fear, both the patients, but also the people who are cannulating, just to be more aware of the burden of this. And in the States, all dialysis patients are supposed to be provided pain relief because that's part of what Medicaid does. But in reality, it seems that that doesn't happen much. And a lot of it is because of the time it takes for EMLA to work. So one person I talked to said that they've been pushed to use lidocaine spray. Well, if you look at the research, I mean, lidocaine spray, it's hydrophilic. You can't pass through the hydrophobic skin barrier for the fistula. So anyway, the biggest thing I think I've learned is just the the ongoing dread that's almost more like patients on biologics or patients who are getting these, have to have a constant dread and fatigue of needles, as well as the pain and the feeling of a lack of control, and the fact that simply sitting in the chair for that extra hour, it adds up to like 9,000 hours a year of extra time. So it's, well, that's, I guess that's for 800 cannulations. So it's not for one
Okay.
person, but still it's like, every time, if you're getting cannulated 152 times a year, it's 152 hours of waiting for EMLA that you could have been doing something really fast, do a Buzzy in 5 minutes. So there's a lot of burdens of trying to get pain relief that end up making people just more depressed and feeling marginalized.
You know
No,
who's afraid of needles?
And did you
you,
get
This guy. And I'll be honest with you, I have this conversation all the time with patients in vascular access where they say, I'm afraid of needles. And I say, I am too. It's a lot different when it's pointing in your direction. And
yeah.
so taking the time to really, reassure the patient. And I would say, like, my experience as a clinician with anesthetics for IV therapy, in the peri-anesthesia realm, we did a lot of lidocaine. Like, everyone, it was all about your comfort, like your experience in anesthesia, things like that. And I'll say in my practice, that was probably the only time that lidocaine was readily available for like venipuncture.
Hmm.
And only some people had knew about or had the foresight or brought or had prepared with EMLA. And it's interesting to see different options. I remember as an ER nurse, my focus being in pediatrics, used to have this little look like a tab you would pull a bowstring back, but it had little like points on it, and the aim of that was to desensitize the area that you were going to do an injection, like an IM injection, and it was helpful and it was non-pharmacological. So I am really excited about talking about this, basically non-pharmacological ways to help treat people. What if they have an allergy to lidocaine? What do you do then? And the options available to patients, and when you can do something that works very well and doesn't require any worry about allergies and sensitivities. So
And
One of
I think,
the,
oh, go ahead, Amy. Go ahead.
so one of the cool things that Judy and I talked about on an hour-long thing that's going to come out is how we understand pain now. And so pain is actually mostly what your brain is expecting. And so when you have had bad cannulation experiences in the past, even if you feel nothing and they don't even puncture the skin, people will feel it and scream. So the good part about that is that if you can give people control by either choices or by even physically controlling a device, or by knowing that they're bringing it with them, then that control feeling actually reduces the sensation of pain, because pain isn't like a sensation switch in the brain. It's a whole connection between all of your experience. And so it all like flashes with amygdala and hippocampus and ACC and thalamus and all these areas of the brain, in addition to a little bit of physical sensation. But most of what pain is this big reaction of what you expect because of past experiences.
I think that's a very
Yeah.
helpful explanation.
Every time you talk, I learn more. So
Yeah.
it's fascinating for me. I love it. So I know we talk a lot about, well, it always confuses me why we stop caring about venipuncture pain generally around when kids are about 6 years old. And these adults that are absolutely terrified, probably because they're the baby boomers and we got a bazillion shots when we were babies, but we're scared to death of needles and we don't care about their needle fear pain. And I believe that everybody, for any type of poke, we should address their pain. And specifically today, we're talking about dialysis patients, but I believe it should be across the board that every patient should have a buzzy. They get to get, or a device that gets them a relief or reduction in pain. But for this topic today, we're talking about using Buzzy for dialysis access and CMS covering that. And what can we do? What are the people that are listening today? What can they go do to help that happen?
So, a couple quick things. I think that we don't care about needle pain because we go into medicine. And so, if you're doing cannulation and you faint at the sight of needles, you're really not very useful on the floor. So, probably we self-select to not care. There's only about a 10% incidence of needle fear in people who were born up until 1985, and then all of a sudden it skyrockets to like now it's 60% of people born in the year 2000. And it's like you've said, the boomers actually didn't get stuck like pin cushions when they were kids. They only got a couple shots before they were two. But we Gen Xers, the very end of Gen X is when they started doing boosters. And so it's the millennials and the Gen Zs who are stuck when they're 4 and they remember and they get freaked out. So that's the thing. And so the putting something, so, and not everybody has needle fear. So that's the other reason, is if you're doing mostly boomers and most of them don't have needle fear, you forget to ask about it if you yourself don't really care. So it turns out that there is a program in Medicaid and Medicare that will pay for innovation in dialysis. So if you've got something that's got a new patent and new FDA indications, and we got a new patent for this cool little design here. So this is the new Buzzy Pro. Oh, it's upside down. Ooh, ah. So,
Oh,
we got a new patent and that qualified. Then we got a new FDA for dialysis and blood donation and lab draws, so that qualified. And so if we get enough letters to Medicare saying actually this would be helpful, they'll pay for 65% of this for people or for a clinic. And so here's the new box. Ooh. But the really good thing, I know. Well, the important thing for me is we've done so much with injections and chronic fear and people who have to do shots and just the dread that what we've learned is that having control and having a ritual really help. And so this is something that people can do themselves if they're cannulating at home, because it's got the ice packs that you can reuse, and it's got a D-ring strap so that people can at home, have their ice pack, choose cold or less cold with the white side, put it on like that, and then they can put a D-ring strap through it. And so then they can make a little loop and put it on their arm themselves, and put it over the fistula for like 30 seconds, then slide it up when they're ready to cannulate and clean, just like you would with Buzzy for an IV. But the important thing to me is that this is something that, okay, so you put it like that and it's got a little hole in the end. And this way you can put it on and patients don't have to be dependent on somebody caring. Because,
nice.
Here's how you put it on. So you put it on the fistula and then slide it around. And then there you go. There. So you put it on and then turn it on. and then just wait, get your stuff together, and then move it up and leave it in place and do the top. So we're so anyway, so I think that it's really cool that there's an innovation program. Buzzy Pro was the only thing that applied this year. It only pays for it for 2 years, but it's, I think, enough to change what I'm hearing, which is that a lot of centers don't have the EMLA, and you kind of get shamed into not using it, or there's a shortage, or people don't even know that there's an option. And so there's a lot of shame that comes in the clinics. And if you're trying to do it at home, you can't spray yourself with vapor coolant spray because it doesn't work fast enough. The most recent studies on dialysis pain, people were using lavender oil to try to relax because everything else isn't working. So that's kind of sad. So the fact that there's a program at all and it can get paid for and it's perfect for home use, that's where I think this is exciting.
It is exciting, and I think we need to support it. I'm going to support it. I'm going to write a letter to CMS and support this. Not
Mom.
I am. I believe in this. And I'm on a lot of the kidney disease Facebook pages, and I listen to what these patients are going through, and it's heartbreaking. And some of them just give up because of, like you said before, pain of being in the seat for 2 hours, pain of cannulation, just feeling like crap. And
dread.
Right. And they just give up. So we need to do everything we can to lessen that discomfort of having kidney disease, end-stage kidney disease.
Yep.
So I support this. I hope you guys do too. It doesn't take much. We're gonna have a little blurb within this post after Dr. Baxter sent it to me about what you can write, and we're gonna make it easy to do the right thing. So if you guys would help support this, help some people that aren't as fortunate as we are, possibly. There you go. There's my plea. We got 3 links for you to hit today. Do the surveys. We got patient survey, clinician survey, and if you would, write to CMS. Let's support this and help our end-stage renal disease patients.
Yeah, we can do better.
Absolutely.
We can do better. We need T-shirts. We can do better.
Yeah.
That's it. Okay.
In support of the better. I appreciate that.
Absolutely. I went the wrong way.
Judy went the wrong way.
What's new?
Well, my Lord.
All right, Blake, I'll let you take us out.
Awesome. Well, thank you, Judy and Dr. Baxter, for joining me today on Facebook Live. Much appreciated. As Judy said, we've got links galore. So we've got the patient survey, we've got the clinician survey, and we have a link if you'd like to support finding better, basically being able to provide better pain reduction strategies for our dialysis folks. That's all in the links for this description of the video that you're watching right now. So stay tuned, and thank you guys again for coming on. And with that, I will take us out.
Princess wave. Okay.
Well,
bye,
hey, thanks for tuning in, guys. Happy Friday. You can follow the Association for Vascular Access anywhere out there on social media. That's Facebook, Instagram, LinkedIn, and Twitter. And if you're a big fan of YouTube like I am, you can check us out there as well. And with that, we'll catch you on the next one.